Several diseases much in the news. Certainly Ebola has generated a great deal of attention, but we've also heard about the Enterovirus here in the United States, and we've begun to see some cases here in Florida. It's vastly different from Ebola. Dr. John Lanza with the Florida Department of Health in Escambia County has joined us. Good morning, Doctor. Nice talking with you again.
Good morning.
Specifically, the difference between these two, one is extremely serious, the other one less so, at least so far as we can tell.
Enterovirus is one of the 400 or 500 different types of cold viruses that are out there. 6 weeks ago, we had a flurry of cold-like illnesses seen by our physicians in their clinics and at the emergency departments, some of which tested positive locally for enterovirus. A couple of samples were sent off to the state lab, and last week one of the samples came back positive for this enterovirus, d68.
This particular virus, as you refer to it, is a cold virus, although I'm sure there's many millions of viruses out there that can cause that. Describe this particular illness, the enterovirus, and how it affects people.
Cold viruses, of course, produce coughing, sneezing, sometimes low-grade fever, runny nose, congestion. D68 was discovered in California in 1962, and in the intervening 50 or so years has produced outbreaks, local clusters of cold-type symptoms, but occasionally produces more severe effects, especially in the very young or those who are immune-compromised. In other words, those with asthma, COPD, etc., seem to have a worse respiratory illness, very similar to RSV, respiratory syncytial virus, which is something that we see every year. So this year, for some reason, the enterovirus D68 has become more prevalent in the United States, producing more significant disease than it ever has before, and I'll be interested to see the analysis by the CDC. They should be working on that right now to see why this is an issue this year and it hasn't really been an issue before.
Dr. Lanza, because we're dealing with a virus, that means that it doesn't respond to antibiotics. Many of us lay people have a hard time getting our minds around that and understand the difference between a virus and a bacteria.
Right. A virus is a very basic form of germ versus a bacteria, which does respond to antibiotics. There are antivirals out there for specific types of viruses, but there is not a vaccine or treatment for the enterovirus.
The enterovirus apparently has produced some examples of paralysis as well. Is that correct?
I have heard reports of that, although in some local studies I've seen there were cases of this paralysis where there was no enterovirus found. In other cases, it was found. So I think, once again, the CDC is going to have to do some research on this to see if there is actually an association.
Is this the type of disease for which a vaccine could be developed?
Vaccine development is potential for any type of disease out there, and it's just a matter of company picking up that something that they want to do.
Can we turn to the area of prevention? Certainly that's a major mission of health departments everywhere. What should we be doing as far as trying to slow the spread of this?
It's basically the same prevention for the flu, for RSV or respiratory syncytial virus, as it is for any type of enterovirus or cold virus, which is basically wash hands often with soap and water. For the enterovirus specifically, they're not sensitive to the alcohol-based hand sanitizers. Avoid touching your face, such as your eyes, nose, and mouth, because that's a way of transmitting the virus. Avoid close contact with sick people. Of course, cover your cough and sneezes. That's what we learned to do during the H1N1 issue 5 years ago. Clean and disinfect surfaces with bleach. And, of course, stay at home if you're sick, whether you're a student or a worker. That's an easy way of transmitting the disease if you're actively ill, but you go to a situation where there are a lot of people around. If we're talking about D68, it should present as a cough, sneeze, running nose, maybe low-grade temp. But if you have a child or if you're an adult that has underlying respiratory problems or immune issues, and if you don't seem to be getting better after 3 to 4 days, please call your physician to be sure that you've covered all your bases.
Dr. John Lanza is with the Department of Health here in Escambia County talking about the enterovirus. Doctor, thank you very much for the time. It's always a pleasure to talk with you.
Okay, thank you very much.